Welcome to UMCC Medical Consultants Connector, where your health matters to us. Amoebiasis is an infection of the intestines, which can cause a range of symptoms from mild to severe. A tiny parasite called Amoeba histolytica is responsible for this infection. This parasite is a single-celled amoeba that invades the intestines. It primarily resides in the large intestine, where it can cause damage. Interestingly, most people with amoebiasis don't feel sick at all. They are asymptomatic carriers. Despite not feeling ill, they can still spread the parasite to others through contaminated food or water. However, some people do get sick, experiencing symptoms like diarrhea, stomach cramps, and even fever. In severe cases, the infection can spread to the liver, leading to abscesses, which are pockets of pus. This is a serious complication that can be life-threatening if not treated promptly. Such severe cases need immediate medical attention to prevent further complications. Understanding amoebiasis is crucial for both prevention and treatment. Knowledge about this infection helps us make informed decisions to stay healthy and avoid spreading it. Let's dive deeper into its causes, symptoms, and treatment to better protect ourselves and our communities. Amoebiasis spreads through feces, which can be present in contaminated water sources. This can happen directly or indirectly, making it easy for the parasite to spread. Direct contact means touching something contaminated with feces, such as surfaces or objects. Indirect contact occurs through consuming contaminated food or water, which is a common transmission route. Food handlers with poor hygiene can unknowingly spread the parasite to others. They may not wash their hands properly after using the toilet, leading to contamination. This can contaminate food during preparation, especially in unsanitary conditions. Water sources can get contaminated too, posing a significant health risk. This happens when sewage mixes with drinking water, making it unsafe to consume. It also happens when using contaminated water for irrigation, affecting crops and produce. Travelers to developing countries are at risk due to different sanitation standards. These areas may have poor sanitation, increasing the likelihood of amoebiasis. Knowing the risks helps us take precautions, such as practicing good hygiene. We'll discuss these later in the essay, providing more detailed information on prevention. Most people with amoebiasis have no symptoms. They are asymptomatic carriers. This means they carry the parasite without feeling sick. When symptoms do occur, they vary in severity. Some people experience mild diarrhea, others have severe dysentery. Dysentery causes bloody diarrhea and stomach cramps. Fever, nausea, and vomiting can also occur. In severe cases, the amoeba can spread to other organs. This can cause liver abscesses, a serious complication. Early detection and treatment are crucial in such cases. Section 4. Diagnosing amoebiasis. Diagnosing amoebiasis involves several steps. Doctors consider the patient's symptoms and travel history. Stool examination is the most common test. It helps detect the presence of the parasite. Doctors examine the stool sample under a microscope. They look for the amoeba or its eggs. Blood tests can also be helpful. They detect antibodies against the parasite. Imaging tests may be necessary in severe cases. Ultrasound or CT scans can detect liver abscesses. Early diagnosis is crucial for effective treatment. Section 5. Treatment and management. Treatment for amoebiasis depends on the severity of the infection. For asymptomatic carriers, doctors may prescribe antibiotics. These drugs kill the parasite in the intestines. Symptomatic cases require different medications. Doctors prescribe drugs to control diarrhea and stomach cramps. Liver abscesses require hospitalization. Doctors drain the abscess and administer antibiotics. Prompt treatment is essential to prevent complications. Section 6. Prevention is key. In the fight against amoebiasis, taking preventive measures is our strongest weapon. Preventing amoebiasis involves practicing good hygiene, which is the foundation of staying healthy. Washing hands thoroughly with soap and water is crucial, as it helps eliminate harmful pathogens. This is especially important after using the toilet and before handling food to prevent the spread of germs. Drinking safe and clean water is also essential. Contaminated water can be a major source of infection. When traveling to areas with questionable water sources, bottled water is the safest option to avoid waterborne diseases. Food safety is equally important. Always ensure that the kitchen and cooking utensils are clean. Ensure food is cooked thoroughly to kill any potential parasites or bacteria. Avoid eating raw fruits and vegetables that have been washed with contaminated water, as they can carry harmful organisms. By taking these precautions, we can significantly reduce the risk of amoebiasis and protect our health. Remember, prevention is always better than cure. Stay vigilant and practice these simple yet effective measures daily. UMCC, your ultimate medical consultants.